Monkeypox. That's right, monkeypox is on the rise in the United States with nearly 3,000 confirmed cases, including 2 children. The World Health Organization has declared monkeypox an international public health emergency. This is the same designation used in the past for COVID-19, Ebola, Zika, and polio. With nearly 16,000 reported cases worldwide and counting, health experts are cautioning against complacency. While new cases are concentrated primarily within the gay and bisexual communities, there's no guarantee that it will not spread beyond those groups. Meanwhile, the Biden administration is facing mounting pressure with top-ranking members of the House and Senate demanding answers on how it plans to handle the outbreak. Joining me now is Dr. Peter Hotez, co-director of the Center for Vaccine Development at Texas Children's Hospital and dean of the National School of Tropical Medicine at Baylor College of Medicine. Thank you so much, doctor, for joining me this evening. I'm just going to start off with this. I'm old enough to remember Ebola. Lots of people were afraid, but, there weren't that many cases in the United States. We've got 16,000 cases so far that we're hearing about of monkeypox. How worried should we be? Should we be concerned about public bathrooms? Should we be wearing gloves again at the gas station? What is the level of alarm that people should have right now about monkeypox?
Well, Jason, it's somewhere in between. So my concern is the trajectory of the numbers. So as you point out, we're about 3,000 cases in the United States. It's almost certainly, as it always is, an underreporting. So there may be several times more than that. Also in Europe, especially Portugal and Spain and the UK, the numbers are going up. So it's the trajectory of cases. That's my first concern. And the second concern is that while it's right now mostly restricted to high-risk behaviors, certain populations, eventually it's, as we know from other infectious diseases, it's going to generalize. And once it gets into the animal population in the U.S., it could potentially become a permanent fixture. So I think right now what we're seeing is all hands on deck to contain this and prevent it from continuing to spread across Europe, across the United States, through a coordinated program of vaccinations and antiviral treatments and diagnostics. And it's really going to be a race whether we can scale this up fast enough to prevent this from getting out of hand.
So one of the things that I've thought, and I was not originally having this thought, is that a lot of the hesitancy and the out-and-out resistance to mitigating measures for COVID were because of the fact that it wasn't, the Spanish flu in 1919. People weren't bleeding out of their eyes and dying in the middle of dinner, right? But monkeypox leaves a visual effect, right? You can't hide. You can't still go to the grocery store and pretend that you don't have monkeypox. Do you think that because it is a disease that leaves a visual marker on your face, on your body, that could help raise the alarm and lead to people taking it more seriously than they were COVID, at least initially?
Yeah, I think it's two things, Jason. It's not only the visual effect of the rash, but also the fact the excruciating pain. The New Yorker, for instance, yesterday ran a very, disturbing but really eloquent description of what it's like to have those painful lesions in the perirectal area, in the mouth. It's an extremely excruciating disease, and in some cases, it's even required hospitalizations. The only silver lining is there haven't been deaths so far. So of the 15 to 20,000 cases globally, there's been no recorded deaths. We were worried because the strain coming out of West Africa has been reported to be about 1% deaths. But if this gets into the vulnerable populations, including the pediatric populations, HIV-positive populations, which it's already starting to, if it gets into pregnant women, older Americans, then you are going to start seeing more deaths. And I think that's what we want to avoid is a picture of a child with extensive lesions. That's going to create some sense of panic. And that's why we've got to move very quickly, accelerating the vaccine doses. So the Biden administration is working hard on this. They're hoping to have 300,000 vaccine doses in the coming weeks. it's still not going to be enough. Even the 1.6 million vaccine doses they project coming in from Europe from the company that produces it, Bavarian Nordic, may not be enough. So that's why I call it a race. Race in terms of vaccines, having the antiviral drugs, because they have to be released for emergency use authorization, the tecovirimat and the diagnostic testing. So there's a lot of stress and a lot of pressure on a Biden administration that's already, as you can imagine, pretty stressed out from COVID-19. So being able to walk and chew gum at the same time and a very, very high level under an extraordinary stress, I have great empathy for the leadership of the Biden administration on this. It's going to be very tough.
Speaking of races and empathy, one of the concerns that a lot of public health officials have mentioned is that, look, Central and Southern Africa have been dealing with monkeypox for a long time, but for some reason, nobody seemed to really care until it got into Western Europe, right? And we've seen this in the past. If a quote unquote sort of oppressed or marginalized population is the beginning of where a pandemic begins, then nobody really cares until it hits people that quote unquote the public cares about. What kind of role do you think that could play in how the Biden administration moves forward? Because it would seem to me that as much as coming up with vaccines for America, they should probably be sending vaccines abroad to get to the patient zero to keep it from spreading to the rest of the planet.
Well, two things. I mean, you heard today from the White House how there was some boasting about how the U.S. and now has more monkeypox vaccine doses than any other country. I see that as a two-edged sword. We don't want to repeat the hoarding issues that plagued the global COVID-19 response. Look, this is why we set up our National School of Tropical Medicine at Baylor College of Medicine and Texas Children's Hospital in Houston more than a decade ago, because we realized that the spread of these tropical infections is accelerating because of political instability and urbanization and deforestation and now climate change. And so this is a new normal for the country, and we have to be able to manage it and recognize that pandemic preparedness is going to be every bit as important as military responses and all the things that we also do to protect our homeland security.
Fortunately, an apocalyptic future that hopefully we can prevent with good behavior. Dr. Peter Hotez, thank you so much for joining us tonight on The ReidOut.